Assalamu alaikum. Welcome, everybody. Today we'll be talking with Dr. Aadam about colon cancer screening. This is timely and in the news, and this is something that we wanted to get our first session up and going and focused on. Dr. Aziz Aadam is an attending in interventional gastroenterology at Northwestern Medicine here in Chicago, widely known throughout educational circles with fellows and residents, and has a reputation for being someone that's considered an expert. So with that, let me turn it over to you, Aziz.
Thank you for having me, Ashok. Really excited about this opportunity to kind of educate our community.
Thank you. This is something that we really wanted to focus on with this committee, this new MCC Health Committee, Health and Awareness Committee, which is trying to bring education to our local community members about their own health and trying to bring awareness. So this could be anything related to public health, flu, coronavirus, epidemiological stuff, in addition to their own personal health matters, cancer screening, cardiovascular disease, taking care of an elderly one, while also trying to take care of your own children. And perhaps for those from MSAs that are joining us, our intention is to hopefully be able to create content and cultivate information that is also relevant to you as well. So with that, we'll get started. This is something that recently was in the news with the untimely passing of Chadwick Boseman, better known as the Black Panther for many of our children. I know my children really looked up to him and were really saddened by hearing about his loss. But it's also a good reminder for many of us that, you know, our health and our livelihoods are only in the hands of Allah subhanahu wa ta'ala. We do have a responsibility for being stewards of our own health and making sure that we're accountable for our own health. With that being said, I wanted to talk a little bit about colon cancer today and colon cancer screening with Dr. Aadam. So one of the things I was really interested in learning and talking about this with you before, I didn't realize that colon cancer is preventable.
Yeah, so that's what's interesting about colon cancer. And when you think about screening for cancer in general, a lot of the cancers detect cancer itself, but colon cancer is actually one of the only preventable cancers, truly preventable. And the way that it's preventable is through colonoscopy, which is one of the most widely accepted methods for colon cancer screening. And colonoscopy allows for the removal of precancerous polyps before these polyps have the opportunity to become a cancer. And once they're removed, you stop that track towards cancer. And that's why it's one of the most and only preventable cancers out there.
That's good information to know, because I think many people in our community, within our Muslim communities, tend to think of cancer as just something that's fated to them. I was destined to get it. But in this scenario, it sounds like this is something that we can actually prevent by looking for it, right?
That's absolutely correct. Is you know, the best methods are screening and prevention. And, you know, if you could prevent a cancer, and this is not something that is a rare cancer by any means. Colon cancer is the second leading cause of death amongst, you know, all Americans. And it's increasing in Southeast Asian populations. It's increasing amongst African Americans, especially at younger ages. The most common age range that we're seeing cancer now is in their 40s and 50s. And we're seeing cases also in people younger than that. There's some signs, there's some, you know, reasons that, you know, that may prompt you that you shouldn't really ignore. And that's really important to, you know, kind of maintain your health.
So if you're someone like me, young 40, but, you know, when should I consider getting screened for colon cancer?
Yeah, that's a great question. So in general, what we consider average risk Americans, the new recommendation by the American Cancer Society is to start screening at age 45. Now that's for average risk. Now, if you have a family history of colon cancer, you may need to be screened earlier. If you have any other issues, like for example, issues with rectal bleeding or other health conditions, say ulcerative colitis or Crohn's disease, or even a change in our bathroom habits. If you notice a significant change, that's something that should prompt you to speak to your physician about. You know, sometimes we think that these are kind of taboo type of subjects, but, you know, again, this is something that's really pertinent to your health, truly preventable, or even if there is early cancer, oftentimes can be cured by minimally invasive methods. And that's really, what we try to do is try to identify um, people before they get cancer, or try to find early cancers that can be removed in a very simplistic, minimally invasive method, where people aren't subjected to extensive therapies.
So one of the things that was interesting about the news article recently was, seeing Chadwick Boseman, he passed at the age of 43, but it sounds like he had cancer 4 years ago when it was initially detected.
Mhm.
So he was less than 45, which is what the recommended age is for initial screening.
Mhm.
Can you speak to a little bit about why somebody like him, or what sort of factors may have predisposed him, that perhaps our community members should be aware of?
One of the most important is genetic factors. Sometimes if there's a family history again, or predisposing conditions that increase your risk of colon cancer, there are hereditary syndromes. There's also, again, ulcerative colitis and Crohn's disease. If you have an extensive history of cancer, maybe not just colon cancer in your family, but others such as histories of uterine cancer or breast cancer, some of these may represent an underlying genetic syndrome that predispose you to an increased risk, and that's something that you need to talk to your physician about as well.
You mentioned some other screening methods in addition to colonoscopy. What are those, and what does that look like for someone that's considering screening?
Yeah, that's a great question. So there are other methods available. There's some at-home methods as well. One of the most popular ones is a test called Cologuard, which is a stool DNA test. It requires an individual to actually collect their own sample at home and send it back in the prepackaged that they get sent to their home, and they send it to a lab, and then they'll get the results soon thereafter. One thing to keep in mind is that is a true screening test. It's not preventative. It detects actual cancer. So it's not preventative. The other thing to keep in mind is that if you take that test, you will use your screening benefit. And if that test becomes positive, you will need a colonoscopy, and you may be subject to higher out-of-pocket costs through your insurance company because you already used up your screening test, and now the colonoscopy becomes diagnostic. So our preferred method is colonoscopy because it's truly preventative. It's the gold standard, and you may require one anyways if another test is positive. A lot of people are apprehensive about colonoscopy. Some of them are kind of gentle myths that it's uncomfortable, that you're going to put what where, that sort of thing. But keep in mind that patients are sedated for this. Almost everybody tells me that they didn't even realize that they had the procedure done, or you're done already, that sort of thing. It's a little cumbersome to take a bowel prep, but you have to think about it as part of the process, and it's a way for someone to identify and visualize your entire colon. And again, you're trying to do everything you can to keep yourself healthy and prevent cancer.
Alhamdulillah, this is really good information. Um, I wanted to let everyone know that we'll actually be doubling back with Dr. Aadam to talk soon about gastroesophageal reflux, also a very common syndrome that's seen within our communities. Most people just tend to think of it as just belching or heartburn that doesn't really have any other untoward side effects, but there's actually some really good Islamic information that take into consideration with things like that. So thank you, Dr. Aadam, for making time this morning. We appreciate it. Inshallah, we'll be in touch again soon. For those of you that are out there watching this and may have questions, please feel free to email the MCC Health Committee. Our email is posted within the link within our bio page on our Instagram page, and also within our MCC Facebook page as well. Thank you again, Dr. Aadam. We look forward to talking with you again soon. Assalamu alaikum.
Thank you for having me. Well,